By the time you hear this sentence, within 3 seconds, someone in the world will be newly diagnosed with dementia. That's a disease that has no cure or survivors. Out of the 55 million people in the world living with dementia today, a staggering 41 million of them never get a diagnosis. If my aunt had that early diagnosis, she would not have died within 3 years of her diagnosis. That is why, when my own mother also showed her first symptoms, we took quick actions to get a confirmed diagnosis. And today, 5 years in, she has only progressed from mild to moderate Alzheimer's. So, as you can see, the world is failing people with dementia, and that hurts all of us. The problem we are facing is that GPs just don't have time to address all the concerns of patients, and they don't have the specialist dementia skills as well to provide a satisfactory and timely diagnosis. So, what does this happen? This results in multiple revisits, and it hinders early diagnosis and it delays the treatment. Now, early detection of dementia, as everybody would agree, can help in delaying the progression of the disease. It maximizes the quality of life and it allows families to plan better for the future. It also helps in identifying patients in MCI stages, which is the pre dementia stage, for new drug trials. And it significantly helps reduce hospital waiting lists by pushing genuine referrals to the top of the list and removing unnecessary referrals. So our solution, Cogni.Dx, was established to give an unbiased early access to dementia diagnosis and care. We firmly believe in the aphorism that 80% of the diagnosis can be made by history alone. So our primary innovation is a digitized, AI-based, history-taking, and performance-based assessment tool. Our estimated total market opportunity, and this is an estimate only, is 2.2 trillion. Our serviceable market demand is 6.6 billion. And finally, the realistic obtainable market is 102 million pounds. Our vision is to initiate a service that will provide long-term care and maintenance. We want to expand to more neurological diseases like MS, epilepsy, and Parkinson's. And finally, we want to have a low-cost, highly predictable approach that democratizes access to fast dementia diagnosis. So far, we have spent 2 years researching, fine-tuning, and developing a functional version of our web-based tool. And we have tested our algorithm on 200 patients in COVID, and we have achieved a 97% accuracy rate. And finally, we have developed a very comprehensive IP strategy, and we have also developed a strong advisory team. In our next steps, we want to collaborate with major key players in the dementia ecosystem. We want to refine our AI model and accuracy through newly approved clinical trials in Saudi Arabia and the US. And we want to embark on a biomarker study to compare our diagnosis to amyloid PET scans. Our unique selling point is that we offer a preliminary diagnostic impression remotely from the comfort of the patient's home within 30 minutes. We provide 11 subtypes of dementia and MCI. We reduce waiting times by 66%, and we have achieved a 97% accuracy in referrals. We know we don't have a cure for dementia, but with your powerful support and our dedication towards dementia, we can at least rise to the challenge of delivering the changes needed. Thank you very much.